Let's move over to the liver and kidney expert, I think, right after the heart, Dr. Arvind Soi. I think, Avi, I would really want you to talk about, because a lot of people are concerned about the impact on the liver and the kidney. How does COVID affect the liver and the kidney? What are the symptoms? What are the gastrointestinal and liver manifestations of COVID-19? What do patients with pre-existing, disease, how do they handle that? Should they be going in for liver transplants during COVID? How safe is it to go to the hospital? So there are a number of, issues around that. And I'd like you to, give your opening remarks as well, please.
Thanks, Akshujeet. It's a pleasure to be here on this forum today. So amidst all the gloom, let me first say the positives, if there are any. And I think there are, because we've had a lot of learning, and I know we've lost some precious lives, and that's very sad. But the good things are that we know how to treat this virus much, much better than we did in the past year. So for the third wave, if that were to happen, and it's likely to happen, I think we're going to be able to flatten it compared to the second wave because of many reasons, some of which have already been clearly spelled out by Dr. Trahan. And some among those are that we are better prepared for handling children with COVID. We had a lot of cases of young people getting COVID this time, and we're probably going to have many more in the third wave, but now we are geared up. There are pediatric beds being made available. There are pediatric protocols of treatment which are being circulated countrywide, so, and ICU facilities being ramped up. So we will be better equipped. The second thing is that we'll be better equipped in terms of essentials, specifically medicines and oxygen. Those systems have been sorted out. So if there were to be a third wave, I'm sure we'll be able to deal with, the sick patients much better on these counts. We have more beds, ICU as well as non-ICU COVID facilities, and some of them were temporarily created, and these are going to be kept in anticipation of the worst, but hopefully we won't have that. So we'll be better prepared from that point of view as well. And then, of course, everything about the variants and the mutants is not bad. 2 doses of vaccine still work to prevent severe disease and death in more than 90% of the cases. So that is something we must take notice of. And of course, Dr. Trahan has already spelled out that we have this monoclonal cocktail by the Regeneron, Cipla, as well as Eli Lilly, and these will prevent hospitalization and severe disease in 70 to 80% patients if taken in the first week. So, these are the positives. If you can take any, these are the learnings from the first and the second wave, and these we take into our hands as we move forward. And hopefully, of course, the biggest silver lining is that the government has their hands on a much, much healthier vaccine stock now. So, the Serum Institute and the Bharat Biotech are going to ramp up their manufacturing capacity to a total of nearly 18 to 20 crores a month by August. So, Dr. Trahan spelled out some numbers of how many vaccines we should do every day, 70 and then 90 lakhs a day. So that's going to be a reality with these numbers of vaccines available. Novavax, which India has actually envisioned to have 1 billion doses of, is showing excellent results in trials. There is more than 90% protection, even against the new variants. So that's a positive. And that's going to be manufactured by the Serum Institute as well in India. And we're going to have millions of those doses. So I think everything put together, we will see, us coming out of this pandemic and getting, over this over the next few months, hopefully. So with those positive remarks, I'll then now switch on to the GI and liver and kidney disease that you want me to talk about. So now, I think the first thing is that patients who have any evidence of liver disease have to be extra careful in preventing COVID from happening to them. And prevention is general, obviously the usual etiquette for COVID appropriate behavior, which everyone knows, but still half the people don't practice, and that's avoiding crowds, physical distancing, proper masking, and hand hygiene. And then in terms of diet, strict no to alcohol. People who already have liver disease should not be taking alcohol. They should control their weight They should control diabetes and lipids if they are abnormal. And they should be going for regular checks to their doctors. And then what is a liver-friendly diet is a question I get every day in scores on my WhatsApp. And I think that they should take more nuts and fruits and vegetables and garlic and fish and sunflower and olive oil and whole grain wheat and some tea and coffee in moderation. A no-no is all kind of sugary and salty diet. And of course, I already said no to alcohol and white bread. Even rice is not that great. So these are the food tips. And then if somebody already has liver disease, we, as a part of 3 global registries, have actually seen that about 15 to 20% of them will progress to more severe forms of liver disease if COVID strikes them. If they already have moderate to severe liver disease, unfortunately, there is 10 to 15% mortality. Now, as you know, the mortality of COVID in general population is between 1 and 3%. So if somebody already has moderate to severe liver disease, then they have 10 to 15% chance of dying. And we have, in our more than 400 patients, we actually written a paper on this and published it, have found a similar mortality. I think it was 14%. We are part of, like I said, 3 global registries which have the same results. So what I have been advising patients of moderate and severe liver disease is that they should actually go in for a transplant because, again, in our data as well as the global registry data, I'm a stickler for data. So I'm not just giving you my opinions. I'm actually telling you about data that is published. So there is a mortality of about 5 to 8% among liver transplant patients, which is, as you can imagine, half of what it is in moderate and severe liver disease. So it's much better to actually have a transplant if one is suffering from moderate or severe liver disease and one is a suitable candidate for transplant, and if one can, have access to it, rather than just sit at home waiting for COVID to get over and, landing up into trouble because of COVID and severe liver disease as a comorbidity. Vaccination. Now, even though I have personally written emails to all my patients who have liver disease or have had transplants, that they should go in for any of the 2 vaccines available in India, I still keep getting personal messages. Doc, I'm thinking I'm traveling. Should I have the vaccine? I'm thinking I'm taking this medicine. I'm taking aspirin. Should I stop this? Should I have the vaccine? The simple answer is, the vaccine is most important for people with comorbidity, and chronic liver disease and chronic kidney disease, especially if you're on dialysis, are the very reasons that you are at high risk from COVID, and you must have vaccination and full 2 doses of it. And of course, Covaxin is spaced by a month, and people who have Covishield can take it, 12 to 16 weeks apart at this point in time. But if you are actually going to schedule some surgeries or traveling abroad, then the government has allowed you to have it earlier. So yes, please go in for that vaccine because it's going to be your biggest protection against landing up with severe COVID. So with those remarks, I'll now touch upon what happens to patients when they have no liver disease and they get a COVID, and then they will get an abnormality of their liver test, their alkaline phosphatase or SGPT or SGOT goes up, and then they come to us in a panic situation. Well, the liver also has the same sort of cells, that's the ACE2 receptors, that the lung has. So the COVID virus attaches itself in the liver. Like Dr. Trahan said, it's a systemic disease. There are lots of organs in the body where the virus can actually lodge. It lodges in the liver as well. But luckily, liver has a lot of reserve. So although there may be some inflammation in the liver, and people may get modest elevation of SGOT, SGPT, alkaline phosphatase, sometimes even bilirubin, usually, in more than 97% of the cases, this is pretty harmless. Unless there is a pre-existing liver disease, they're not actually going to be materially affected in terms of having a liver problem because they had COVID. COVID-related liver failure in a previously healthy individual is almost unknown. So you will have elevation of liver tests for maybe 2, 3, 4 weeks, and then they will slowly settle down. If you see a liver expert, they're going to give you some liver supplements and nutrients, but there is nothing to worry if the liver enzymes are up because of COVID. That's the least and the last of your problems, right? Now, a word about kidney disease. Now, chronic kidney disease is another reason why you could be more susceptible to severe COVID. And if, God forbid, one gets COVID, then one can have a higher mortality from it, with or without dialysis. So again, please do not hesitate when when you're thinking of vaccinating if you have kidney disease. And all the people with comorbidities need to up the frequency with which they're following up with their doctors, whether it's heart disease or kidney disease or diabetes or liver disease. Because obviously you need to control it. You see, if you have, and Amrish will bear me out, if you have diabetes which is well controlled, that's much less of a risk than a poorly controlled sugar. So similarly, if the liver disease is well controlled, that's a lesser risk. And if the liver disease is out of control, hepatitis B or C or a cancer or any other form of liver disease, whether it's fatty liver disease or alcoholic liver disease, then you're in more serious trouble. And that's why you should keep seeing your, liver and kidney and heart experts regularly. So those are the few comments I'd like, to people to, take home as a message. I'll be very happy to answer any questions.
Thank you, Dr. Soi. That was again very useful. I'm sure a lot of questions have been answered. But while you and Dr. Train have been speaking, quite a few questions are being typed in the Q&A. We'll of course go back to those. I will read out some questions. It might be useful if you might want to simultaneously scroll through those so you can straight away know which are the ones relating to your field.